from West Virginia. I did my undergraduate training in West Virginia. I went to West Virginia School of Osteopathic Medicine for medical school. I spent actually a year internship at CMC in Charleston, West Virginia, before moving on to my orthopedic residency in Cleveland at University Hospitals. From there, I went on to do a one-year sports medicine surgical fellowship at Beacon Orthopedics in Cincinnati. While we were there, we worked with a couple of high-level athletic teams, Moeller High School, one in particular. We also had the opportunity to work with the Cincinnati Reds, which was a huge learning opportunity as well there. In terms of services provided, obviously being a fundamental orthopedic surgeon, we see all the fundamental aches and pains, hip, knee, shoulder pains, dealing with high school athletes all the way up to the adult weekend warrior. Beyond that, having specialized training in sports medicine, I certainly love and have an additional passion for being a previous athlete. I love treating all types of shoulder pathology, from rotator cuff tears, ACLs. Shoulder replacement is certainly a niche that I really enjoy as well. The fellowship opportunity we had working with the Cincinnati Reds was fantastic. It gave us great insight into treating high-level professional athletes, both on the field and off, surgical and non-surgical. And while they are professional athletes, obviously a little unique, certainly niche, but a lot of the same principles apply to non-athletes and non-professional athletes as well. And so it's been a great opportunity to translate those principles of practice into everyday use. So what makes a great orthopedic surgeon, in my opinion, is I think first being a simple human being, connecting with the patient on a human-to-human level. Certainly the training applies to better understand and then walk through the injury, what brings the patient in, listening to the patient, actually hearing what they are saying and understanding that, but taking the time to walk through the injury itself, the treatment options, and making sure the patient feels like they have a voice and a say in how we're going to proceed together. I can certainly make suggestions, but it has to be a team effort, essentially, in creating that definitive plan. I think the most important thing to remember in seeing me as an orthopedic surgeon is that you're not obligated to or signing up for necessarily a surgical procedure. It's really important to remember that we're here to evaluate the injury or the complaint, definitively understand what it is, what our treatment options are, and that a huge portion of patients that walk through the door don't actually end up needing surgery. And making that definitive treatment plan with the patient, understanding what's best for them so they feel safe and confident going forward, is the most important part. Sometimes that does include surgery, but a lot of times it's aggressive non-operative treatment.